Hi, my name is Rebecca Gallivan, and I actually have Lyme disease, just like many of you. And I started seeing Dr. John Catanzaro about 6 months ago regarding my genetics, and we found out I have Lyme. So I started something called Smilebox, and if you stay tuned after the video, then you'll be able to learn more information. Thank you.
Welcome to Health Coach Seven's Lyme disease and methylation presentation. I wanted to welcome you to this. This is really a very comprehensive disease, which is highly controversial in a lot of ways, but very complex. And I wanted to just demonstrate to you not just the methylation cycles involved, but I also wanted to demonstrate to you how extensive it could be affecting brain activity and just as well as the immune inflammatory pathways and such. Many people are actually experiencing very debilitating symptoms associated with Lyme, and some have been diagnosed late because because it's not the presentation is not always clear, and it's very difficult to really get good diagnostic clues sometimes. And the thing is that it's not a simple process. I wanted to show you here a couple of things that, in correlation with Lyme, you're going to see some interesting relationships. This is actually a SPECT scan that is actually demonstrating for the infection of the areas of the brain that were affected by Lyme disease. And this is a SPECT scan after treatment with a traditional ceftriaxone, which is actually a traditional agent that's used for Lyme treatment. And going down to the very neuronal level, if you look at the neurons, you're going to see a lot of crossover where neurodegenerative diseases are actually manifest, where you're going to see things like Lyme disease and similarities to multiple sclerosis. And if not, you might even see that there could be Lyme-initiated diseases, and you never know that Lyme toxin can actually produce MS-type symptoms by demyelinating, causing demyelination on the neurons on the axon itself. These myelin sheaths are there to protect the neuron from harmful effects, as well as help with normal transmission of electrical activity that's responsible for brain transmission, if you will. Okay, very important to be knowing this. And even in cases of Alzheimer's with fibrotic changes in the brain, they're seeing the possibility of initiating factors. So could be that Lyme disease is an initiating factor for MS, and it could be initiating things like Parkinson's and maybe even Alzheimer's. Okay, very important. If the Lyme is undetected and it's not taken care of, it could persist for years and years and years and cause gradual damage in the blood-brain barrier as well as in the brain tissue itself. And then, of course, we've got a lot of things, some basics here to go over. With methylation involvement, I'm going to get into that in just a minute. But Lyme disease is actually a spirochete infection. There are several type of organisms and co-infection organisms. It's a worldwide transmission. It's not just in one location. You can actually look at this spec sheet by going to igenix.com. It's a very informative spec sheet or PDF document that actually will go through it in detail so that you can actually get a full sense of what Lyme is, how it is tested, and what the co-infections and other tick-borne diseases are in the environment. And when we talk about spirochete infections can definitely activate that immune process to where you're going to have an excessive amount of inflammatory movement as well as high immune reactivity. And if the immune system doesn't respond appropriately, then the disease actually persists and causes these terrible breakdowns in the central nervous system. So I would actually recommend that you read through this because this will give you some clarity. igenix is a great lab. They do testing. They have a very, very low rate of false test results, where either false positive or negative. A lot of the main reference labs do, unfortunately, because sometimes they're in a rush. They're using Western blot, but these big labs are busy and are not specializing in the Lyme origin. And a lot of times it's incomplete assessment. So, like for instance, when you're actually doing a Lyme assessment, you need to be looking at those co-infection or other related organisms, because it's not just the Bergdorferi here, or the Bartonella. It's actually these other organisms that you have to be paying attention to, like the Babesia and the rickettsial relationships. So don't ever just because you get a Bartonella that comes back negative, think that you're completely negative. If you still have symptoms that are presenting and you still have autoimmune related inflammation. And as I mentioned, you can actually see that it's not as simple as, okay, well, uh, I just have to get rid of the organism. Yes, that's part of it, but you have to prevent autosensory disturbances and inflammatory autoreactivity that actually causes more brain changes like you're seeing here, and effects on the nervous system. Now, with regards to methylation, how does methylation relate to this? Well, methylation can actually be, as soon as the organism is hit and the Lyme toxins are in the environment, the cells immediately, like on the neuron level, the DNA expression will change. And what you're going to find is you're going to have a DNA, a methylation cycle disturbance. And most oftentimes, the methylation disturbances associated with this and inflammatory movement is really more along the lines of hypermethylation in this type of infection. Doesn't mean that hypomethylation can't happen, but the problem here is that methylation uh, is a normal phenomenon that actually occurs with an exposure. So in other words, the shift in methylation is going to occur. So trying to focus in on methylation while the body is trying to compensate for exposure, once you actually find out if the organism is present or you have some kind of irritation that might be similar to Lyme that would be affecting the methylation, you actually have to address the exposure first, because the normal consequence of a hit that the body takes from exposure like this, especially with the brain, central nervous system, and peripheral nervous system, is that the methylation is going to be altered. And to try to fix the methylation cycle as a main focus of therapeutic is not a good idea. You probably want to be focusing in on getting the immune effects, dropping the inflammation down, getting rid of the organism, of course, if it's present, and then the methylation cycle will begin to normalize, and you can gently nudge it. So it's not a great idea to support with high methylation donors that you find in traditional and integrative bionutrients or bioceuticals. You probably want to be doing, very, very little there. You don't want to be aggravating things like CBS. You don't want to be moving pathways in the methyl movement to accelerate more DNA agitation, because the DNA agitation is already there. Okay, that's why there's many articles out there in relationship to viruses doing this as well. If you actually focus in on methylation when you have that viral exposure, you can actually encourage more viral replication because you're focusing in on the methylation movement. So DNA methylation, yes, it does need to return to a normal uh, movement, and that's done on a cellular level. But the adjustment is going to be facilitated by addressing the peripheral factors, the exposures, and then you can actually come back and support the methylation cycle with biochemical interventions that would assist with that. Okay, so it's very important to know that. So it's very those two. This is a very good. If you, what I basically did is I just said Lyme disease and brain function, and you can see all these images. You can even see something on the theory of biofilm and the use of the Borrelia species. But this is kind of showing the persistence of Lyme due to biofilm adherence. Very real deal right there. So I would say that you can do a lot of research there, and I just wanted to pull those up to show you the brain relationships. And like I said, IGeneX is a great resource. I mean, if you go to IGeneX.com, they're going to outline for you all of the different immunology, what the tick-borne diseases are like, Lyme diseases, define them for you, more particular than any other lab that's out there. Then I want to show you here Lyme disease and immunity. There are about 69 different gene controls that are involved in the process of defense. Of course, there's probably more than that, but the HLA antigen system and antibodies movement is much involved in this. And the interesting thing about this too is that when you have Lyme exposure, if you did Lyme and macrophage, you'll actually find that mast cell reactivity is one of the hallmarks of facilitated body activity in defense initially, but then it causes some significant disturbances because the macrophages are going into tissue, especially with the brain being sensitive. They're very destructive, and Lyme, persistent Lyme, and Lyme toxin can facilitate mast cell reactivity. So you're going to find that chronic mast cell reactivity is another consequence of Lyme exposure, and that's the reason why it's very difficult to control this, because the Lyme producing inflammation is it could be provoked by more mast cell recruitment, and it's a very difficult thing to assess sometimes. And then I looked up at how many gene controls that we would see in Lyme disease, and there's about 69 known genes, including the metallopeptidases, and these are actually very pro-inflammatory, MMP1, MMP3. You actually see those also in mold. So one of the things you have to realize that in spirochete infections, the immune system, the same component of the immune system responds to things like mycoplasma and various types of mold the same way. So sometimes you can actually have a negative Lyme or negative co-infection Lyme component, or if you're looking at everything, you can have a positive mycoplasma or positive mold that can actually facilitate some of the same reactions in the immune system and cause the same kind of inflammatory activity. So that's why it's really important to be thorough in the workup, because the methylation disturbances, when we see methylation disturbances will be actually facilitated by interactions of certain type of immune uh, control signals. Like, for instance, tumor necrosis factor is a very inflammatory type of a gene control. So is interleukin 6. They're all part of that normal cascade movement. But then you have interleukin 10 that is supposed to be there to facilitate a regulatory control to calm that hyperreactivity down. That's one of the interleukins that's involved in regulatory movement. But you have a lot of pro-inflammatory gene controls here, like the interleukins, interleukin 1, 4, complement factor H, which is very much associated with Lyme disease. You're going to see that the Lyme disease spirochetes contribute to the activation of the complement factor H, which is a gene that actually can definitely affect methylation cycle. So it's very important for you to know that the HLA system, which is known as the human leukocyte antigen processing system, very much involved in responding normally. And of course, there are other factors in the immune system that help to defend and reset and regulate. All of these work together to actually, or in a symphony or in a collaborated effort to control various types of effects that you might see in the immune system, inflammation, neurosensory system, etc. So, as you can see, it's not as simple as just saying, well, the methylation cycle is off. It's more along the lines of there are gene controls that are affected that will, the DNA, bottom line is that relational genes and the responses. So you got to remember that this is a very complex process. And yes, simple as getting rid of the organism. Yeah, if you get rid of the organism, you get rid of the offending agent, you do a lot to begin the process of healing. But if you're having persisting type of symptoms of inflammation and autoreactivity, and you know it's Lyme, or it's a Lyme related issue, or it's mycoplasma or mold, um, these exposures can actually mimic the same way. You've got to deal with those exposures, very much so. So as you can see, very complex process, but there are solutions to this process. The epigenetic intelligence that is created by a systematic approach. Okay, the gene sensitivities and susceptibilities can demonstrate whether or not, like for instance, a person is having a CFH uh, sensitivity. And I've actually worked with a lot of clients already that have actually are Lyme positive clients that actually are double mutated in this particular complement factor H. And if you actually looked at complement factor H in detail on gene cards here, you can actually research it yourself and see what it does, how it activates the immune system, and what it's responsible in controlling. So, very real factor. As you can see, there are a lot of publications here that are talking about the CFH binding ability with Lyme disease and relapsing type infections, as well as controlling immune reactivity. So innate defenses are controlled uh, by this gene here, as well as other genes. But complement factor H is very much implicated in Lyme disease movement, and it's one of the gene controls that is evaluated on 23andMe data. And as I say, people that are heterozygous and homozygous positive will actually come up with a sensitivity, and there's cross relationships with Lyme infection, as well as some other um, infections, as I mentioned, the mold and mycoplasma. People actually come with CFH. It's not the only thing. There's the HLA series. I think it's the HLA 1135B, which is part of the HLA DRB1 complex. And you're going to find that these gene controls, if they're sensitive, you may not be getting the full I would say, balance of the immune system that needs to be there because of the sensitivity. So then the immune system needs some help, some way. You got to figure out how to create that help. And the other often associated sign is that we find that lymphocytes shift, which means white blood cells that are the defending cells of your body, they begin to shift and they become depleted in the infections. And they can be depleted in Lyme, any kind of spirochete, uh, rickettsial type organisms, etc., mycoplasma. You're going to find that these depletions are very strongly associated with a call for these specialized cells that are supposed to defend. One of those are like natural killer cells of the CD57 class. And then you also have natural killer cells of the CD56 and 16 class. These things should be evaluated because if your immune system is actually on a low ebb and depleted, there are ways of stepping up the immune relationships that way too. And the other thing is evaluating the regulatory controls, CD4 CD8 interaction, which is known as T4 T8, which are your cells that control defenses and regulation. So, like in other words, there's a check where you get that defense and attack against the organism or attack against the agent, and then there's the regulatory control that comes in saying, okay, that's enough. Now you need to stop because it's controlled. And when these things are out of sync, that's when you have more reactions like inflammatory and autoreactivity movement, and you can actually have more aggravations like mast cell recruitment and chronic mast cell activation. So you can see where we're going with this. It is definitely something you want to be thorough on, but it's also a strategic plan is necessary. And with regards to methylation corrections, we always want to focus in on addressing the peripheral factors first, and then gently nudging the methylation movement biochemically. And that's not an easy task. Creating the epigenetic intelligence is definitely the goal here to create a better immune response and adaptation. So, yes, very important. If you have the organism, we need to find the organism. If you don't, you still have components that are very similar to Lyme, then it might be something other than Lyme that actually facilitates the same kind of immune response. So anyway, that kind of concludes what we have here today on methylation and Lyme, and I hope it's been helpful. You can always get a hold of me by contacting www.healthcoach7.com, or you can email me at info@healthcoach7.com. I'd be happy to address any questions that you might have. And a lot of people send me a lot of questions all the time, so I can't get to all of them. But I do try to get the questions out there that everybody's familiar with and most people ask. And then there are some questions that are more specialized that I will take on. But in general, you can always consult with me if you have a very complicated process going on right now in your health, and Lyme is part of that. I work with Lyme for many, many years. I've been in the medical field, working with autoimmune disease, cancer, and chronic infections for 20 years, and their genetic and epigenetic relationships. So I look forward to again the next webinar, which is going to be methylation, further methylation relationships, and look forward to the broadcast. It'll actually be posted, and you'll be able to download it and listen to it. And I look forward to providing that for you. Well, have a nice day, and thank you for listening. And we'll talk again. Bye-bye.
Thank you so much for watching that webinar, and I wanted to tell you guys a little bit about my journey and what led me to Smilebox. I have been dealing with issues for the past 3 years, saw many practitioners like most of you, spent more money than I really ever wanted to spend, and had many symptoms. Not all seemed that they were related to Lyme disease when I looked up Lyme disease, but as it turns out, a lot of them are the result of having Lyme disease. So I found out about 6 months ago that I have Lyme disease. And the way I found this out was through Facebook. I saw a post about this company, Health Coach 7, which is who you just watched the webinar with. And they do the genetic testing and genetic consultations. And I had a consultation with Dr. John Catanzaro, and saw a lot of the things that I was predisposed to having. And through that, and looking at all my lab tests that I had done in the past, he had decided that we really needed to test for Lyme disease. And I ended up doing the IGeneX test, which is a California-based test, and it's the most accurate test so far for Lyme disease. And I found out that I had the infection, and that I also received a parasite called Babesia. And those can create very similar symptoms, so it's hard to know unless you get the testing what you have. So that was about 6 months ago, and we started treating actually just a few months ago, because we were first working on my immune system. And through treatment and basically through everything that I had been going through the last few years, I've had the most supportive friends and family. And one of my best friends, she actually came over to my house about a month and a half ago and brought me something that she named a Smilebox. And this Smilebox contained so many different items, a lot from my favorite grocery stores that I shop at, organic grocery stores, and different cosmetics and skincare, and different inspirational quotes and lip balms. I mean, anything that you can name was basically in this box, and a bunch of our friends donated all the products. And it made me happier than I had been in a really long time, because as a lot of you know who have Lyme disease or any sort of chronic illness, you start to feel really isolated. And even if you have support, you kind of feel alone in it because you're the one who's experiencing the symptoms. So receiving something like this and knowing that there were people out there that were supportive of me really kind of changed things for me. I'm not saying that I feel totally better, but it's kind of given me a different mindset. And so that same night that she gave me the Smilebox, I laid in bed and I thought about the 11,000 people that are just in this Lyme support group on Facebook. And I read their stories almost every single day, and have kind of always wanted to find a way to give back to the Lyme community. And I thought, I want to create a Smilebox for all these people who have Lyme disease, but I don't have enough money to do that. So I ended up creating a GoFundMe account. And it's kind of ironic because it's not for me, it's actually for other people. And I've had a lot of friends and family donate money. And the donations have been anywhere from $5 to $200. Whatever the donation is, it basically goes towards these Smileboxes. And the Smileboxes go towards anybody with Lyme disease. And so I created a GoFundMe account and started raising money for people like you, or maybe somebody you know who has Lyme. And I use those donations and I put lots of awesome things in a box and send it to Lyme patients. And this can be someone who is nominated, maybe someone you know who has Lyme, or even you yourself. I get a lot of emails from people who have Lyme or from friends or family. And I really try my best, as long as there is money being donated, I try to send boxes to all of these people within about 30 days of getting the request. So I kind of wanted to show you guys what's in one of the boxes, and it's actually a box that's going to be going out this week. I'm not going to tell you who it's for, but it has some pretty awesome products in it. This is actually a card. They're all different cards, but they're handmade cards, and they have, I don't want to show you because it has someone's name in it, but they have inspirational quotes. And then I also include a little bit about myself, so the person getting the box isn't confused who is sending them a box of random things. So there's information about that. And then each box is a little bit different. A lot of it is really including some of my favorite things. Like, this is one of my favorite bar soaps. It's organic. It really doesn't cost that much, and it lasts for like 6 months. So I include these in almost every single box, honestly. And then I actually just started including doTERRA. They actually make something called TerraShield, and this is a tick and insect repellent. So I'm finding that people are really enjoying getting these. And then this is actually donated by Gabriel Cosmetics. They sent me a lot of products. This is a nail polish and a mascara. This is the only cosmetic line I use because it's organic and gluten-free. Also donated is Primal Palette. It's my favorite paleo website. They have the best recipes, the best cookbooks, and they donated their spices. And then I really like to include a little inspirational journal. This one says, always find reasons to laugh. Okay, this is gonna seem really random, but I also include my favorite organic toothpaste. If you've tried organic toothpaste before, most of them are pretty gross, but this one's awesome. And then I always include a little snack. I included Justin's Honey Almond Butter and then some trail mix. And then lastly, but it's still in the package, I normally will include some sort of comfy clothes. So these are pajamas. And that's what's in this Smilebox. So each of them are different, and I really hope that the people who get them feel inspired and it makes them happier. And if you would like to donate, you can actually go to smilesforlyme.com. And my name's Rebecca Gallivan, and thank you so much for watching this video. Oh my god, I totally forgot what I'm saying.
It's still recording.
Oh, it's still recording. So you can follow me on Instagram at Smiles For Lyme. I'm basically on all the social media, also on Twitter and Facebook. And you can always go to smilesforlyme.com to read more about my journey, why everything was started, where your donations go to, and how you donate. Thank you very much.
Yeah, that's good.
Creepy smile at the end. You can email me at Smilebox. Pause.
You good? Just keep going. You can email me at.
Oh, goes a little bit crooked.
Right.
Oh, la 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 la. Shit, I don't know what to say. This must be what movie stars feel like.
We're starting with thanks for watching that webinar. That's where we're starting.
But I'm going to keep talking after that?
Yeah.
Okay. Wait, hold on. And then, wait, I'm sorry. Am I doing the whole thing about my journey?
Yeah.
So, okay. And if I'm being serious when I say this, I know you think I'm joking. If my mouth was super crooked, will you do like...
No, you look really good right now.
Am I talking crooked?
No.
I wonder why I do this when I...
It's the other way, number one.
Oh, it is?
Yeah. Yeah. Like that.
So first of all, I would like to tell you guys that this is what happens when you have Lyme. Okay, starting it.
All right.
Wait, what am I starting with? I'm so sorry.
Thanks for watching this webinar.
Oh. Yeah, got it.
I want to talk to you a little bit about.
Yeah. Yeah.
Okay, you're the pro, so you just fine.
Okay.
I think that's pretty good.
I didn't know what you wanted me to do.
No, that's okay. I'm just getting some of that stuff.